This year's cyclosporiasis outbreak in the U.S. is officially the worst on record, as the CDC says there are more than 4,100 confirmed cases across 41 states.
A bag of shredded lettuce can be eaten in 10 minutes, but the illness it carries may not appear for another 2 weeks. By the time the first person calls a doctor, the same batch may have crossed state lines and disappeared into thousands of meals. That is how a recall can arrive after the damage is already done. On July 14th, the Centers for Disease Control and Prevention had confirmed 1,645 domestically acquired cases of cyclosporiasis since May 1st, compared with 249 by roughly the same point in 2025. That was about 6.5 times last year's pace. By July 27th, the count had jumped to 6,707, with more than 11,500 additional reports awaiting confirmation or investigation. So the claim that this outbreak is 6 times worse is already outdated. The latest confirmed total is roughly 27 times the 249 cases reported by mid-July last year. Although the comparison dates are not identical, more importantly, today's count is still describing infections that often happened weeks earlier. So let's talk about how we got here. Cyclospora has a season officially running in the United States from May 1st through August 31st. Cases normally rise during spring and summer, giving a large outbreak camouflage because the first increase can resemble a familiar seasonal pattern. This year, that familiar curve turned almost vertical. The first major warning centered on a cluster in Michigan, Ohio, West Virginia, and Kentucky. Investigators asked sick people what they had eaten during the 2 weeks before symptoms, then compared ingredients across their meals. Shredded iceberg lettuce served at Taco Bell kept appearing in the answers. On July 17th, Taylor Farms de Mexico recalled iceberg lettuce sourced from central Mexico. The recall included market-side iceberg salad and shredded lettuce sold at selected Walmart stores, plus food service products distributed across 27 states. Taco Bell said it stopped using lettuce from the affected supplier that same day. But the recall did not freeze the count, because a recall stops future exposure while surveillance measures past exposure. By July 24th, the Taco Bell-linked cluster had reached at least 1,947 confirmed cases across 9 states, with 98 hospitalizations and no reported deaths. Illinois, Kansas, Oklahoma, and Pennsylvania had joined the original 5 states. That 1,947 figure is not the whole national outbreak. By July 27th, the CDC counted 6,707 confirmed domestically acquired cases across 45 states, including the lettuce-linked cluster and 423 hospitalizations. Officials were also investigating other clusters and illnesses unconnected to Taco Bell or Taylor Farms. The parasite is Cyclospora cayetanensis, a microscopic organism that infects the small intestine. People usually become infected through food or water, contaminated with human fecal material. It does not normally spread directly between people, so the outbreak follows a supply chain rather than a social network. That sounds reassuring until you understand the timing. Cyclospora usually takes about 1 week to cause symptoms, but the window can run from 2 days to 2 weeks or longer. During that silent interval, people keep eating, stores keep selling, and investigators have no patient to interview. Symptoms often include frequent watery diarrhea, cramping, bloating, nausea, appetite loss, weight loss, and severe fatigue. Without treatment, the illness can fade and return for weeks or months. The recommended treatment is trimethoprim sulfamethoxazole, but diagnosis has to happen first. Diagnosis is another bottleneck because routine stool testing often excludes Cyclospora. Even standard parasite examinations can miss it, so clinicians may need to request a specific test, and patients may need to provide multiple samples. Every missed test turns a real infection into an invisible data point. The parasite is also unusually difficult to trace to one meal. Investigators lack the rapid whole genome sequencing used for many bacterial illnesses. So they rely on targeted genotyping, interviews, receipts, supplier records, and ingredient comparisons. The CDC says it can take as long as 6 weeks to classify a reported illness. And this is not a problem you can solve by staring harder at a salad. Contaminated lettuce can look and taste normal, while ordinary washing cannot guarantee removal. And routine chemical sanitization may not kill the parasite. Cooking can kill Cyclospora, but iceberg lettuce is usually eaten raw. Now add the capacity problem, because this pathogen demands slow, labor-intensive public health work. Each case can require a clinician, specialized laboratory, local interview, state review, federal classification, and separate food traceback. Fewer people do not create contaminated lettuce, but they can make the signal slower to assemble. The CDC lost more than a quarter of its federal workforce between January 2025 and March 2026, falling from 12,934 employees to 9,453. In April, it paused more than 24 diagnostic tests during a laboratory review amid the downsizing. Although those pauses were not specific to Cyclospora, the point is shrinking surge capacity, not one canceled test single-handedly causing this outbreak. Leadership has also been unstable. Susan Monarez was removed as CDC director in August 2025 after less than a month, and several senior officials resigned amid disputes over scientific independence. The agency still lacks a Senate-confirmed director, although its principal deputy and chief medical officer roles are filled, and Jay Bhattacharya is performing delegable director duties. The administration's proposed 2026 budget would have reduced comparable HHS discretionary authority from approximately $126.1 billion to $94.7 billion, a reduction of roughly 25%. Congress blocked some of the deepest proposals, but staffing losses, contract changes, reorganizations, and turnover had already disrupted operations. Expertise does not instantly return because a line item survives.
The CDC is scaling back this critical program called FoodNet.
The program had required monitoring of 8 pathogens, but the agency reduced it to just 2, leaving Cyclospora for states to track on their own.
It disrupted the flow and weakened the flow of scientific funding for this kind of agricultural science investigation and investment that needs to be done.
Cyclospora requires thousands of interviews, specialized tests, data reconciliation, and rapid communication, all competing for a smaller pool of experienced people. When a disease already carries a built-in reporting delay, reduced capacity compounds the lag even when it did not create the contamination. A survey of 142 current and former CDC workers in chronic disease and injury programs found that only 2% said their unit remained fully operational, while 95% believed Americans would die because of the changes. It did not measure the foodborne disease team directly, so it indicates agency-wide strain, rather than proving that this investigation was delayed. But a system with almost no spare capacity has less room to absorb a nationwide surge. On July 21st, Health Secretary Robert Kennedy said the outbreak was under control. Yet confirmed domestically acquired cases rose from 4,173 on July 20th to 6,707 on July 27th, largely as earlier illnesses moved through laboratories and health departments. Control can describe food removed today, while official numbers reveal what happened last month. For the person who gets sick, the economics are simple. At $20 an hour, missing 3 8-hour shifts costs $480 before adding a clinic visit, laboratory test, medication, childcare, or symptoms that continue for weeks. A $4 salad can become a several $100 household shock. For businesses, the costs spread through discarded inventory, emergency suppliers, sanitation, refunds, legal claims, lower traffic, and damaged trust. Retailers and restaurants must trace products by supplier, lot code, date, and distribution route, while customers see only a plastic bag or menu item. The cheaper and more interchangeable an ingredient looks, the harder its risk is to explain. The immediate lesson is not that every piece of lettuce is contaminated. Check the specific Taylor Farms recall, discard or return affected products, and contact a health professional if prolonged watery diarrhea follows a relevant exposure. Because testing is not routine, mentioning Cyclospora may separate a diagnosis from another uncounted case. What happens next is a race between the parasite's calendar and the reporting backlog. The CDC expects counts to rise as delayed cases are classified, while the Food and Drug Administration continues traceback work and separate Cyclospora investigations remain open. Even a perfect recall cannot erase infections already incubating. The next update may show the contaminated lettuce leaving the market and new exposures falling. It may also add thousands of people whose illnesses began before anyone knew what to recall. That is the silent outbreak. By the time the chart explains the past, the next meal has already been served. So, what do you think? Do you think we will get a handle on this outbreak soon? Or will the cuts by RFK lead to an even greater concern? Don't forget to subscribe so you don't miss the next one. Thank you for watching.